I will start with a vignette case scenario. A 30-year-old woman has episodes of chest discomfort and fatigue with exertion over the last several months. No prior health conditions. 30-year-old, rather young, isn't it? So you probably have some diagnosis, differential diagnosis in your head, chest discomfort and fatigue, what it can be. Maybe something related to the heart, something related to the chest, or some psychological conditions, or chronic fatigue syndrome, whatever. Okay, some hints. On the examination, there is cyanosis, central cyanosis, pronounced clubbing of all fingers and toes, late systolic heave of right sternum. So there is a murmur, which has a 3/6 mid-systolic murmur over the pulmonic area. Now, you probably have limited your differential diagnosis towards a heart problem, isn't it? Then you do, of course, some tests, laboratory tests, and you find elevated hemoglobin and decreased oxygen saturation. Decreased oxygen saturation, hemoglobin, so there might be something related to the perfusion. Maybe there is a, what? Yes, a defect in the interatrial septum. There's an atrial septal defect. In a 30-year-old, you rarely find it. It is delayed diagnosis, of course, because this kind of heart problems, they usually are recognized earlier, preferably in childhood or in adolescence. So this is a late diagnosis, we can say. Now, after having this information, if you are a medical student, you will have some questions in your mind, of course. If you are a medical doctor, you have just graduated, you have some other questions in your mind. If you are an experienced doctor or a professor of cardiology, you will probably think on really something different. Which questions would you ask? I don't even know your background, but you're probably medical students. So what kind of information do you need? What kind of learning needs, or what kind of questions come into your mind for this particular patient? Would you like to learn something about the murmurs? Would you like to learn something about the surgical therapy of the cardiac condition, this atrial septal defect? Or is there a medical therapy of that? Or some palliative treatments? Probably you should have some questions now in your mind. Let's say you're a medical student and you ask, how are cardiac murmurs classified? Because in this patient vignette, we mentioned that there is a 3/6 murmur. 3/6. What does this mean? So a student it is expectable or very normal that the student is asking about this classification. What does it mean to have a 3/6? What is 6/6? Can we hear a 1/6 murmur? Is that abnormal? After which level is that? So these are all questions coming to the minds of beginners in learning, let's say, students. And this actually is what kind of question? Is the foreground or background? This is a background question because you need to have this knowledge in order to build on that and ask more sophisticated, more complicated, more difficult, answerable clinical questions. So students could ask, what normal developmental process has gone wrong to cause this patient's septal defect? Embryology, questions about embryology. How does cyanosis develop in patients with hypoxemia? What is clubbing? Because this patient had clubbing, and where do we see this clubbing? Are there other causes of clubbing? So these are all background questions. While an experienced doctor could ask, among adults found to have atrial septal defect, does the presence of right to left shunt and Eisenmenger syndrome, so they know already what Eisenmenger is. A student would ask, what is Eisenmenger syndrome? Indicate a worse prognosis compared with patients in whom this has not occurred. So in grounding, that implies, you will learn it if you don't know, that these chronic atrial septal defect or septal defects, they cause some shunts or some irreversible conditions, and one of them is the Eisenmenger complex or Eisenmenger syndrome. And this is in fact a foreground question. For adults with another question, adult atrial septal defect complicated by Eisenmenger, is surgical repair of the septal defect associated with enough improvement in symptoms? So as you see, there are the background questions are very simple with only two components, while the foreground questions, the answerable clinical questions, which is today our topic, is more complicated, has more components. The differentiation is actually very easy. Students usually ask these background questions, while as your level or increases, as your excellence increases, you start to ask more foreground questions. This is a nice representation of that, what we have said so far from the book of Sharon Strauss. Unexperienced, you ask more background questions, but you may ask also some foreground questions. As your experience increases, you're still asking some background questions, but mainly you are asking foreground questions. So it doesn't mean that background questions are bad or unnecessary. They are all important, but we have to differentiate between these, because in science, in evidence-based medicine, once you have become doctors, we are expecting you to ask these foreground answerable clinical questions. So in brief, background questions, we all need both background and foreground questions. And as our experience increases, we go for more foreground questions. There are two components, as I said, of background questions, namely a question root, like what, who, where, when, etc., a verb, and a verb. What is it? What does it mean? How do we classify? Why did it happen? So these would be all background questions. How does heart failure cause pleural effusion? What causes swine flu? How are cardiac murmurs classified? These all background questions. Okay, time for another break to make it short and easy to follow. Stop recording.